Okay, ladies and gentlemen, we're going to get this day started with our first panel of the day, and it's titled Healthcare in the Gulf, an Investment Opportunity. And the panelists for this panel are Dr. Nadim Al Daij. Please welcome him to the stage, the co-founder and CEO of Sahati Kuwait. He's also an emergency medicine physician and a Harvard Medical School senior associate. Next up, we have Dr. Musa'ad Al-Razuqi, Chief Business Development Officer of Kuwait Life. Please welcome him to the stage. He's also a maxillofacial surgeon and the first Arab to graduate Columbia Business School MBA with a focus on healthcare. Yes. Next up, we have Mr. Badr Al-Sayr, Director of Al-Sayr Group Holding Kuwait. Please welcome him to the stage. And last but not least, Dr. Ahmed Alungul, Executive Director of Abir Medical Group. Dr. Ahmed, welcome to the stage. Thank you very much. And moderating the session, your favorite moderator, Dr. Celeste Litorco, SWFS expert from Kingdom of Saudi Arabia.
Thank you. Thank you very much, Mohammed. Good morning, everybody. I'm so excited to moderate such a prominent panel and with such an important topic, healthcare, the new trends of healthcare in this region and the investment opportunities. I guess that this topic is very dear to all of us, and I'm very triggered to hear from so many different backgrounds and experts, a different point of view, how this challenging period has affected, but as well might have benefited the industry itself and our lives, our daily job, and the overall emerging trends at the global level and for the region. I'm sure that we are all aware by now of the importance of the sectors itself for the humankind without any doubt, but as well as we were discussing yesterday as a new niche that can attract important investment from both sides, the financial side, and I would say even more importantly from the sustainability side, where we stop for a second and we think how we can invest, and investing doing something good for ourselves and for the humankind. But without further ado, as we have such prominent panelists, I will let them introduce themselves and as well start telling their point of view on the new trends.
Thank you so much for having me here today. It's an honor to be amongst you. So my name is Nadim Al Daij. I'm a consultant in emergency medicine. I practiced for about 20 years in Switzerland, in the US, and in Kuwait, my home country. I've worked in clinical medicine and in public health policy as well. And I currently run Sahati, which is a digital health company based in Kuwait, co-founded by the creators of Carriage. And what we're doing is we're essentially building a primary healthcare service with a digital front door. Our focus is to really emphasize the preventive care. As Musa'ad put it correctly yesterday, it's a top priority for the region, and as well as on the chronic disease management and the management of stigmatized conditions. My 2 cents, I think, on you know, as an intro to this panel, I think that there's a lot of tremendous opportunities in health in the region. We are, you know, despite our wealth, we are still a developing region, and in healthcare, we've chosen some priorities many years ago that have not given us the biggest bang for our buck, unfortunately. We've put a lot of emphasis on curative care, on hospital care, on treating illnesses, and yet today we have the fastest growing chronic disease mortality rate in the world. We have the most obese and diabetic populations in the world, here in the region. building more hospitals, more infrastructure is not going to solve the problem. So we need to start kind of reshifting or shifting our focus on priorities that have been proven to be effective in improving the outcomes of our populations. And those are primarily the foundation of the healthcare pyramid, which is primary healthcare and prevention. So just a quick little intro on my, at least my belief and my passion here in healthcare. Thank you.
Thank you, Nadim. Dr. Mustad.
Bismillah ar-Rahman ar-Rahim. Good morning to everybody. To me, I usually like to start these types of panels by saying that healthcare does not equal hospital. And hospitals, as we know them today, are actually an Arab invention. The first ever hospital was set up almost 800 years ago in Damascus. And the reason we set up a hospital, as not just an Arab race, but as a human race, was because there were people dying from the plague and they need to be isolated from the general population. Today in 2021, do we really need to build these huge, as I call them, cathedrals of care? Do we need to spend billions setting up a physical building where people go to get treated, right? Now, before this COVID pandemic, the well-known statistic, the size of the global healthcare industry, does anyone want to venture a guess at how big? The entire global healthcare industry before Corona is $7 trillion. So to put that in perspective, and it's definitely, at least if you count just the vaccines and the growth in PPE and the growth in digital technologies of healthcare, it's definitely at least 8 to 9 trillion today. Definitely. There's been at least 20-30% growth. Just to put it in perspective, if I look at just the industry of the heart, cardiovascular surgery, beta blockers, the medicines that go into heart care, this industry is larger than the entire automotive industry, including Tesla. If I look at the industry of diabetes as a disease, the industry of diabetes, insulin, dialysis, doctors specialize in diabetes, that disease industry is larger than the entire fast-moving consumer goods industry. So anything you can buy in a supermarket or even online retail and what have you. That's how big healthcare is, and it's getting bigger, not only because of the new technology that are rising, but for the simple fact that as humans, we're living longer. And the unfortunate part of healthcare, or the problem that we have to solve, is that 80% of the spend of healthcare occurs usually in the last 2 months, some even say 2 weeks of your life, right? So these are some of the challenges, some of the trends. Obviously, as I mentioned yesterday, prevention is becoming increasingly important. Again, it's nothing new. But definitely, as you're looking to deploy assets and diversify, healthcare has traditionally always been a very safe haven and will continue to be so. Because compared to most other industries, not a nice to have. As we all know, it is a must-have. And it's changing a bit, but in general, allocating a significant portion into healthcare, into new technologies such as genomics, proteomics, even digital health technologies, to me, it's a must-have, actually. Thank you.
Thank you, Mustad.
Assalamu alaikum. Good morning. Thank you for having me today. It seems like I'm the only person who doesn't have a doctor in front of him. And I represent the dark side, unfortunately, today. So let me play the devil advocate. I'm a third generation coming from a family business that's been always in the automotive sector. And to, do a structural shift to an investment to the healthcare and education sector. And today I'm, going to talk about the healthcare. We made a couple of investments in the healthcare in Abu Dhabi with GICC and in the primary care in Jeddah. And we're seeing dramatic change, especially after COVID, going through after the post-pandemic, and we see there's a huge shift. People, even perception changed, investment, VC. I mean, if you take, putting things into perspective, VC, the investment of VC in first half of 2021 is 14.7 billion. And if you look at the whole 2020, it's 14.6. And if you look at 2019, it's around 7.7. So it's almost doubled. So that gives you the importance of healthcare and the investment of healthcare. We see a big shift happening. We see global players are coming here. More family businesses are focusing on healthcare. Yeah, I mean, seeing it from a financial perspective is something important. We see there's a big opportunity when it comes to consolidation. The market is still fragmented. Also, we see a big shift toward preventive care, which Dr. Day will talk about it even more. And I think it's a very, very exciting subject.
Thank you, Bade. Dr. Ahmed.
Good morning. Assalamu alaikum. And thank you for having me here. It's an honor to be a part of such a, I would say, a diverse panel and such an audience. Well, I'm Dr. Ahmed Alungal. I'm the second generation member from a healthcare group named Abir, primarily operating in Saudi and spread across the GCC. So we are essentially a primary healthcare operator, mostly with the primary care centers extending up to secondary care. So like it was mentioned here, until the beginning of COVID, we were a traditional brick and mortar, big hospitals and big clinics and, thousands of patients visiting every day. So luckily, COVID, as in disguise, was a blessing to change to a more online presence, going for teleconsultations and telemedicine and home care services. And this is, I feel, was a trend across the market. You saw more number of home care services coming up. A lot of services that you thought could never be given at home were more coming to your doorstep. A lot of services that were only available in the West suddenly started popping up in the Gulf. So this was a good change. So I see the future of healthcare is away from the big hospitals and the big centers. And what we envision in that is, as Abir, in Saudi, we see around 10,000 to 12,000 patients every day walking into our centers. So at least we hope to convert 10% of that to a home care setup, wherein they won't have to come. Your consultation will happen at home. Your investigations, your tests will be done. Your medicines will be delivered at home. So trying to reduce the risk of being exposed to a healthcare setup. And definitely, every country in the GCC is now looking at a more cost-effective perspective for healthcare. And the Gulf is especially moving really fast towards that.
Thank you very much. Thank you to the panelists. And I guess that it's very clear, as your intervention stated, that healthcare is on the spot. There is new interest from long-term investors, family office, government. But as well, I think has been highlighted, and I would like to echo Dr. Massad saying that healthcare doesn't mean hospital cathedral of care. And Dr. Arme also highlighted the importance of new way to provide patient with support that could be telemedicine, can be AR, VR. So that brings me to bring on the table the important role or the important new role of technology. And I would say technology is a cross-sectorial innovation element. We see technology applied to many traditional sectors. And I would say that one of them that might benefit, we saw during the pandemic, might benefit even more in the future is healthcare. So allow me to ask the panelists from their different background even from the financial point of view, the new role of technology in this sector? Nadim, thanks.
Thanks for the question. So technology has a huge role to play in healthcare, and we've obviously seen it with our eyes now with this pandemic, being able to better communicate with our providers from afar. So I think telemedicine is the obvious one. You know, telemedicine is nothing new, right? We've had over 30 years of experience with telemedicine across the globe. It's beginning to come into the region. You know, we're still a very conservative region, but I think stepping back and looking at what are the challenges that we're addressing with technology. I think one major challenge that's very specific to the region is the fragmented communication, the fragmented systems of care that we have. Communication is a huge challenge, right? Trying to reach your doctor, trying to get an appointment, seeing them in a timely manner, and then following up, right? Getting your health records available to you. It's still not streamlined in the region. And so there's a lot of duplication, there's a lot of inefficiencies in the communications, in the health communication space. But technology can also help you address problems of standardizing healthcare practice, right? Another thing that's very specific to the region is we have a huge heterogeneity in the quality of care that we provide, because we have providers coming from all over the world. How do you standardize care? Well, you can standardize care using technology through AI, through other data-driven tools, to allow a more kind of standard and high quality service. And then there are clearly other aspects. I think you know, looking at operational efficiency within healthcare institutions, technology can help with that, right? There's a lot of spaces where technology has a role, and I think if you look at some very interesting models in Europe and in the US, or even in the East, you look at successful primary care models, you know, like Babylon Health or Cry, a Swedish company that's one of the fastest growing digital health companies. It's a primary healthcare play that's primarily digital, but now has turned into a hybrid model by purchasing primary care clinics. In the US, One Medical IPO'd last year, and it's a primary healthcare play. So we know that in systems that are not too dissimilar, if you look at the US, it's an incredibly fragmented healthcare system with very poor outcomes at the population level, focused a lot on curative care and almost not at all on preventive care. Well, you have a market now in primary healthcare that's worth over $260 billion. So those are huge numbers, and that, I think, for us, as you folks as investors, seeing this as an opportunity for the region, I think will directly address some of the major challenges that we're facing here.
Thank you, Nadim. Dr. Moussad.
For us, and Dr. Nadim touched on this, we prefer the term hybrid healthcare. Yes, digital technologies are very important, but the human element in healthcare is what makes healthcare a very unique industry. There are industries where personally I believe there needs to be no physical presence. A great example is banking, and even I would say currencies. I don't need a physical currency. I don't need a physical bank. Even to get mortgages, you can all do it online, right? I don't need to physically go there. But for specific industries, I would include education there as well, just because to have that physical interaction, I think, is very important for our social needs as human beings, not just our knowledge needs. But in healthcare, you will still always, forever, need to have that physical presence, because we are physical beings. You know, maybe in the metaverse, we can have digital doctors treat our avatars, but at least in this physical world, you will always need to have a doctor or a nurse care for you and treat you and make you better. Obviously, digital technologies will help leverage their time, because the average physician spends 4 minutes with a patient, because you have to spend time, you know, coding and billing and writing notes and doing all the tedious work of healthcare. So we ideally want them to spend more time with their patients, more quality time. And so, again, this region is a bit far behind compared to the West. But by the way, even the West is far behind. The US, one of the leading healthcare systems in the world, only has 70% of doctors that have some digital form of record keeping. And there's another complete mess, because, you know, nobody knows who owns the data. Does the patient own the data? Does the doctor own the data? Does the insurance company own the data? Here is a bit clear because the government owns everything. So, but again, for us, it's about a hybrid approach. It's about leveraging the traditional healthcare system, the models we're all familiar with the latest technologies, but without the right reimbursement models, it's very difficult for digital companies or digital first companies to grow. It will come, definitely. The question is when. It's probably not going to be in the next 5 years, 10 years, and unfortunately, even though the COVID pandemic really helped companies like Teladoc in the US and Hims and Hers and all these amazing digital first companies, we haven't seen the same reflected here because the regulators in the ministries of health did not enable the payment models to accept these new types of technologies. So that's, I think, also part of the challenge.
Thank you very much, Dr. Massad. I guess that the element of considering the human aspect, a very important part of the delivery of the service, it's of outstanding importance. And personally, I think that that's what makes really the difference. And I guess we will talk about a little bit later about sustainability in this space. And I guess that's an important element that came after the pandemic. It's the S part of the ESG, the social part. And even more in the healthcare space, the human element is so important. And the second element, I guess, is the data ownership. And that goes for all the industries, goes all for the new regulation. I guess maybe in this, the European country a little more advanced, but we will follow soon, and goes for all the industry. Who's the owner of the data? With this, I let Badr.
Yeah, I tend to agree with Dr. Nadim and Dr. Saad. I mean, and echo, you need the human element, and we noticed that very well. I mean, after the pandemic started, we thought that, the whole education and healthcare system gonna collapse in terms of, e-learning and distant learning and all these things, and this is the new trend. But actually, we saw that it came out, it's much, much, much stronger than before. I mean, especially if you look at our operation in dental clinics in Kuwait. I mean, it doubled the operation we had before the COVID, because people tend to come back. I think it's going to go back to normal, but people still need to see a doctor physically, need to meet a doctor, hear them, listen to them. Probably sometimes you need to hear them out, just for the sake of hearing them out. So I tend to agree that you need the human element. Still, it's a big role, but it seems like now technology and the human element working hand in hand. I mean, technology helped us to reduce the bottleneck that happened to the hospitals. So preventive care, people don't have to, to come to physically to the hospital to see a doctor or consult, like Sahati, and you can, tap into it and meet, the doctor. And if you have a consultation, if you have still, you need to be attended in especially acute cases, but you have less tendency to do that. The other big problem we saw that, and it's worth investing in, is the logistics of delivering that healthcare. You saw a lot of bottlenecks, when it comes to hospitals, it comes to supplies of medicine, and you saw the logistics of, whether storing the vaccine or, delivering the PPE, which, it went cost of around 1,100%. I mean, during the first, days in the COVID. So these things you need still, it's a gap that you can invest. Government are supporting to find a solution to, to support the private sector, but still I think we didn't reach an agreement between the government and the private sector where they can work hand in hand.
Thank you very much, Badr. And I guess that we will shortly also elaborate a little bit more about this relationship. That's very important, both at the operational level, and I guess also in terms of investment and gaining the private sector specific know-how with the support of not only the public sector as the government, but also long-term investor owned by the government in order to understand what the industry requires and what is really needed in terms of both financial return, but most importantly, success of the industry. Thank you for that, Dr. Ahmed.
So in terms of healthcare technology, like we said, now everyone is moving towards tele-consultations or home care services. But another point that, another technology that I think or I hope that will be taken forward would be, a more useful representation of AI in healthcare. Like how Dr. Musaad and Mr. Badr rightly mentioned, there is still that, the touch of healing that people seek in healthcare. But it's not possible to provide that touch to every single person who comes to a center. So I hope that, AI would come to a play wherein we'll be able to triage patients in a way that, say, you're just going for your chronic medicine refill. You don't need to go to a center. It can come to your home. In case of acute emergencies, yes, you have to meet a doctor. So that way we'll be able to triage better, use the resources better, and get the best out of the resources that we have. Like Mr. Badr rightly pointed out, in the beginning of COVID, I remember we were getting calls that, there is no the PPE, the gowns, there's no masks available, there's no swabs to take, the COVID samples. The logistics kind of, I think, just broke down entirely. So these kind of things have to be developed, with more of technology on the side. Right now it's running, but it's more on a very traditional way. So AI and, AI-enabled technologies will play a huge role in helping primary care especially. And another point raised by Dr. Musaad was regarding the regulatory, a gray area. So in many countries in the Gulf still, telemedicine or teleconsultation are kind of gray areas. They have certain guidelines, but, it still doesn't give you the power to utilize, the scope, the complete scope of what, telemedicine or teleconsultation can bring. Many governments still restrict it, just that, you can only have the doctors who are licensed in your facility, or you cannot have a doctor from, say, a consultant or a senior consultant from a different place who's specialized in a certain disease to be a part of the panel. So these kind of things, I think, definitely it's a learning exercise, and it will definitely pick up in the region.
Thank you very much, Dr. Ahmed. And I guess you pointed out a very important element, that is how the regulatory system actually, from the government perspective, can support new technology, can support the change and the evolvement of the sector. But before elaborating on the very important relationship between the public and the private sectors, I would like to say a little bit more on the new technologies opportunities on both sides. I think Badr highlighted the importance of logistics as a sector that support the healthcare sectors, AI as a potential element, but I guess there are other important niche where the family office we're attending today, the professional were looking at the healthcare sector with great interest in terms, we want to invest there, but as well maybe we want to invest in something that's financially viable and as well is needed. So if I can pick your brain on which are the already existing technology that can be enhanced, or the new technology you see that will be required, or any other element, aspect, or subsectors that could be an interesting focus for investors.
Yeah, thanks for the question. So I think there are a lot of interesting technologies out there that we can find inspiration from. I think we obviously talked about telehealth a lot. I think One thing I'd like to highlight, particularly to the investors in the room, is we've heard of a lot of investors being reluctant to getting into healthcare, again, because of the challenges, right, in the regulatory space and also the examples that we're seeing. And I think, lessons learned, I think, point to the fact that you really have to understand the needs of the population. You need to understand the patient journey. Technology is not an endpoint, right? A lot of companies build technology to build technology, to say, this is my endpoint. I want to give you access to 10,000 doctors. As a patient, that doesn't help me, right? Doesn't help me to have a list of 10,000 doctors. What helps me is guidance. I need someone that I can blindly enter a system of care that's going to take care of me, that's going to guide me, that's going to provide me with evidence-informed care, quality care. And so I think I think the mistakes that we've done in the past is not really getting that, not looking at it from a patient perspective, but as well as a provider perspective. So I think, again, keeping in mind that technology is only a tool in your toolbox, right? Everything else is what is quality providers, right? Being able to mobilize good providers. Now, digital health can do that, right? You no longer need a building. Having the right processes, addressing the needs, right? We tend to forget that 90% of healthcare can be taken care of by primary care doctors, by family physicians, right? We've done the inverse here. We go to specialists for every symptom that we have. So that's a paradigm shift. Although it's all, as Musa'ad said yesterday, those solutions have been known for decades, if not centuries. So I think that's an important perspective. And when we talk about technologies, I think, as I said earlier, I think obviously creating the right platforms, accessible platforms, user-friendly platforms, safe, secure platforms, right? Data security is a big issue in the region. What standards do you use? And then integrating artificial intelligence. I think that can help standardize, because we know how to manage most disease processes, right? There's nothing new there. It's just about delivering that care and how do you deliver it. And thinking of it less as a vertical, right? As I said, it's not about making appointments or providing a Zoom access to a patient, but looking at it as a horizontal, as a system, right? An integrated system, right? So you integrate drug delivery, lab processing, all that, so you have a end-to-end service for the patient. Because that's really what's lacking, right? When you go to a hospital, you want everything taken care of. Same thing in the digital space. You need to be able to provide that. Maximize convenience, maximize security. So those are, I think, some of the key, I think, technologies that will take time to evolve, obviously, in our region. Regulation is definitely a challenge. And I think some of the good news that's coming out, the recent developments, such as Saudi's 2018 law on data or policy on telehealth, which is a very progressive policy that allows you to get a telehealth license to operate a telehealth center. Same thing here in the UAE, right? They have a policy for past year or two. So those are things that are evolving gradually, and we're going to see more and more market opportunities evolve over time.
Thank you, Dr. Nadim. And I guess that we are highlighting with the previous also remarks of Dr. Musa'ad the fact that technology should be at the service of the industry and at the human side, both for the providers and the customers, I would say, or the patients, because it can smooth the process. You said in one day you can have all done, and you have more time for the personal aspect, and that highlights also the differentiator between service providers in terms of human touch. And I think this is very reassuring for us, because when we look at the future, we're always a little bit scared that technology will take over. And it's very refreshing here that not only the creative side of the human side, but also the caring side is here to stay. Thank you very much.
I mean, excuse me, in terms of global technology trends, which I think will affect more than the healthcare industry, many other industries, but definitely we need it in healthcare, I summarize it as A, B, C, and D. A is AI, B is the blockchain, C is the cloud, and in healthcare we have something a bit more specific called cloud biology, and D is data analytics. These are very important no matter what industry you're looking at, but definitely in healthcare we are very far behind. We're even further behind the airline industry, which is a At least consumers don't really like the airline industry anymore. More specific to the healthcare industry, the technologies that we are really just at the beginning scratching the surface of are genomics, specifically CRISPR-Cas9 gene editing, as well as robotic surgery. We are still in the very early stages, and there are some amazing companies out there in the US and UK that are building technologies that will make actually science fiction look like it's old. And this is happening today. And I just want to touch upon, because we talked about different models, and I want to come up with solutions, not just complain about the industry. So the world's most expensive drug, it's a drug called Kymriah, manufactured by Novartis, a company we all know. This drug treats a very rare disease. And for the drug to work, the patient has to be injected, and then the patient's genomic system, the DNA, needs to make a protein for the drug to work. The cost of this drug is $495,000 per injection. Now, obviously, what happens if I inject the patient and for some reason the patient is not producing the protein? So thankfully, to go back to the point you made about collaboration between the government and the payers and the providers of healthcare, Novartis came up with a very novel approach, which is pay for performance. They will not bill the provider, or in their case, the Swiss government, the $495,000 unless the patient makes this protein. So they're going to keep on injecting until the body says, okay, come and we will start making this protein, which is amazing. You know, unfortunately, doctors, we were graded our entire lives through school. When it comes to now the practitioner and to be graded on quality, we all push back. You know, there are models in France where, you know, some politicians wanted to put the death rate at the door of every hospital, which is, I think, too extreme. But certainly, and I do have to say it is difficult because, you know, as a surgeon, a former surgeon, sometimes you do everything by the book, but the patient's body, for some reason, just doesn't cooperate. And, you know, we joke that the patient's body didn't read the book, but it's because we are really complex systems made. It's not just, we're not like, you know, digital, you know, 1 and 0, you do this, this will respond this way. You know, our genetic code is 4 base pairs, you know, A's and T's and C's and G's. But we do have to start accepting to pay for quality, not just to pay for, you know, quantity and to go and see the doctor, but to actually reward either the doctors or the drugs that are doing a good service. And it's coming. It's definitely coming. And we hope that we see similar adoption of these models here in the Middle East as well.
Thank you very much. And I guess that's a very important change, moving to what in the normal industry we call a customer-centric, I would say patient or human-centric, even more importantly. And I guess when we say human, we englobe also the fact that you'll be efficient but also human at the same time. Badr?
I tend to agree with Dr. Ahmed and Dr. Saad. I mean, you know, big data analytics is the new thing. It's not been new. I mean, it's been, but now it's playing a pivotal role, especially with, you know, predicting outbreaks and how to manage, you know, the COVID crisis in terms of interacting and all. I mean, in Saudi they use it a lot to predict if the person beside you has a contracted COVID or not, and we see it in China. I mean, for instance, sometimes you never know unless you do some research, because, I mean, for example, my dad has glaucoma, so I've been searching about it and reading about it, and now with big data, you see that they have a better prediction of it instead previously. I mean, it used to be around, if it's a good doctor, it's around, the probability of predicting it is around 30 to 40, and now you're talking about they're reaching a 90%, which is very, very crucial. And I'm sure that even in pharma, we see that, you know, people use, I mean, the latest technology is how to predict the outcome of medicine instead of doing a trials on humans or animals. And I think that's a very, very crucial thing. AI and predicting things going to play a bigger role, you know, moving forward. Yeah.
Well, thank you so much, Badr, for highlighting of course, the investor side and the importance. And I guess that data are important in all the sectors. And sometimes when we were evaluating new startups, was fun enough more rewarding, financially rewarding the use of data than the application itself. So my real hope for the healthcare system is that data are going to use primary for improving the system. But if this is coming out from being able to commercialize also this aspect in the right way, so to enhance the performance of the sector itself, because that's, I guess, it's a little bit the challenge, no? How you're going to use the data. And that's totally another panel discussion. But thank you very much, Badr.
So when it comes to data in healthcare, you know, one personal experience that I could put forward was around 7 years back, we introduced electronic health records across our centers. So it was a big approach at that time in a primary healthcare center, you know, completely electronic health records, and, you know, you could see everything across all branches, you could see it on the system and all. But see, there was a lot of data coming in. At the end of the year, you're sitting on a huge amount of data that at that time you don't know what to do with it. You have the data, you can use it, but you don't know how to use it in an essential way. So today, you know, I think everyone has come to a level, you know, we have started using our data to predict, okay, in which months, what are the kind of diseases that people commonly come with. So we're able to, you know, stock the supplies, the medicines based on that, keep things ready. So once we have that trend that we see over a few years, you are able to predict the common indicators that are coming in healthcare. But at the same time, I feel in a medical training, there's not much importance given to this kind of analytics. You are trained to treat a patient, yes. But once you come out of a medical college, when you have to, you know, because you're not just treating the patient, you have to deal with the provider as well. You have to deal with the payer. You are not trained, or you don't have any idea on how to do that. So one initiative that we started was we tried to reduce the number of coders. It's a very cruel step to a doctor, but in a way that helps, that keeps the doctors more aware of, okay, am I ordering the test I'm ordering or anything? Is it really important? Is it okay if it can be avoided, you know, I will keep it aside. Because one test I write, I have to give 100 reasons why. So they tend to keep, you know, be more aware of what they're writing, what the patient is going through. And, you know, the provider becomes more aware of what is going on the payer side as well. Because, again, I always revolve around this cost effectiveness part. In primary healthcare, quality is important, but the second place is for cost. You cannot run a place without being cost effective. Also, like the example from Novartis, it's indeed a noble cause because, you know, when an increasing, you know, medical research is a very expensive thing. Like how, you know, the insulins and all this, the agenda going on behind all this, the medical research and all. It's like saying, you know, in case, like we used to have a joke back in college, like for a surgeon, the surgery was successful, but the patient died. So that way, it is definitely a good approach from, you know, big pharma to come up with something like this that will keep the end user more comfortable to, you know, go for something like this. Because again, for everyone, cost is a huge concern. So that way, movement towards that direction is definitely a big help.
Thank you very much, Dr. Harman, and I guess that's important from both sides. Putting myself on the other side, I wish one day I will have all my medical records on my iPhone, and I will be able to tackle inside annoying, because it's very annoying when you think, where was it, what was it, and so on and so forth. But that was more for the new technology to come.
If I may interrupt on that. Right now, there are many providers that provide that. Like, who would have thought your Apple Watch would measure your ECG, or would measure your oxygen saturation? These are so these are things that that are picking up, that people are becoming more aware of their healthcare, and they want to see their data of what is happening to me personally.
I'm very scared when I see the lack of movement on my Apple Watch. So talking about data and clearly regulation, I guess that an important topic we would like to discuss today is the relationship between government and private sector, or public sector itself. And for public sector, we intend, of course, the government and the regulators, but as well long-term investors, how they can benefit of the knowledge, expertise of the private sectors in terms where to invest and what to invest, and from the government side, which are the regulations that can be conducive to support the sector overall. So maybe I start with Dr. Nadim again on a few sentences of how do you see the relationship between public and private that can be enhanced?
Yeah, of course. When I talk to investors, they come to me and they say, well, but here in Saudi or here in Kuwait, government takes care of most of your healthcare needs. Well, why do we need a healthcare venture? Well, we could say the same of Europe, right, which is the most regulated region in the world with the most stringent healthcare regulations, and yet we have health companies that are thriving, right, in the private sector. And I gave you a few examples. Now, granted, we are more of a developing region, so there's that caveat. But I think that the private sector is a lot more agile, right? And that's the opportunity here, is we're able to adapt to the very, very rapidly changing needs of the population. We're complementary also, right? Because the government cannot take care of everything, cannot reach every single user or patient. And so I think there's both, areas where we could compete with government by providing more convenient, more user-friendly services, but areas where we can collaborate. And I think, yes, again, using the example of remote patient monitoring, huge amounts of data that's becoming available that we could use, right? There are companies that focus on data analytics for healthcare, and that can inform government policies and changes. So I think we shouldn't see it as an all or nothing, or like, I'm not going to get in there because the government's 80% of healthcare. No, I think things are changing, and we're seeing it with Saudi, with the reforms, the clusters. I mean, there's a lot of privatization that's happening, and I think being there early on in that game will help further develop both the competitive landscape as well as the quality of the services provided.
Thank you, Dr. Nadim.
So in terms of data, I will answer your question by asking two questions. And I usually do this to any new employee we hire, or even our summer interns. I ask them this question first. Who owns your healthcare data? Notice the question. Who owns your healthcare data? And they don't get it. They sometimes they'll say insurance company, the government, the hospital, but it's yours. It's your healthcare data. You own it. You have a right to it. Now, HIPAA violations and whatever, now I believe that you should allow insurance companies and governments to use your healthcare data anonymously without your name, because we don't want insurance companies charging you a higher premium for future insurance needs. But we do need to understand the entire healthcare of the population, right? Whether it's from an insurance perspective, actuarial perspective, or a government planning perspective. The second question I like to ask, and feel free to ask yourself this question, is do you know the name of your primary care doctor? If I ask that question in Singapore, and the National Health Service of Singapore has done that study, 9 out of 10 people will answer. If you ask that question here in the region, I don't think you'll even get 1 out of 10 who know. And unfortunately, without, as Dr. Nadeem mentioned, that guide for you to have to help organize your entire healthcare needs, really, you're at a disservice. You know, this old model of the doctor, the family doctor, that the entire family goes and he knows the entire family history, unfortunately, it's dying in our region because people feel that they have a right to go straight to the specialist. I don't think healthcare is a right. I believe you have the right to be part of a risk pool of an insurance, but I'm sorry, if you eat fast food every day and you smoke cigarettes and shisha and e-cigarettes and e-shisha all in one day, you should not use the same healthcare system as somebody who is going to the gym, eating healthy at the same cost. There needs to be some recalibration of risk. So,
Fascinating. I guess coming from an Italian perspective, of course, where health is a public service, I guess it's very interesting to look at a healthy style of life as not a cost on society. And I guess as well that there's lack of awareness, not only in the healthcare industry, of the importance of data ownership and even more of data protection. So I guess that a cross-sectorial new niche of investments, of course, cybersecurity, is data protection, and I would say from a customer point of view, data management. How I know, so maybe the third question might be, do you know how the people or the company are managing your data? Are you aware of that? Because I think it's very important. First, you own your own data, and second, you can decide how your data might be managed. Badr, I'll let you elaborate.
First, I would just ask Dr. Msa. I do both, e-cigarette and go to the gym. I'm included.
by the way, sorry, but doctors, on average, 66% of doctors smoke.
Smokes, yeah.
So the highest smokers are doctors. It's because they feel they can, you know, I don't know. So don't worry, you're not alone.
Okay.
I don't smoke, but maybe my colleagues.
I think, you know, we're seeing a shift in the government behavior toward healthcare. You know, especially we noticed in, for example, here in UAE, it's we see a shift in Abu Dhabi that starting to rely on the private sector. I mean, for example, we experienced a more lean toward, you know, using our facilities in Abu Dhabi for oncology instead of sending, you know, families or, you know, patient to Europe and the States, because, you know, it gives also a psychological effect for the patient himself, because he's with his family close by. He has to go back. I mean, after he finishes treatment, he can go back to his house with his family. So they found that it's a cost-effective, it's a more psychological stability for them. The other thing is, you know, we see that, you know, here, unfortunately in the region, we spend only less than 5% of the GDP on healthcare, which is very low compared to other regions. I mean, very low. And the problem is that, you know, as a GCC citizen, if you look at, we are one GCC citizen, but, you know, the regulations is totally different from one country to another. So you need to work with a lawyer to understand what you can do and what you can't do. And, you know, it's a different ball game when you go from Saudi to Kuwait, Kuwait to UAE. So I think that's, you know, crucial thing need to be sorted out. The other thing, I think that, you know, the government realized now that they have to rely on the private sector. You know, when it comes to logistics, when it comes to how to supply the medicines, I mean, they still figure out they don't have the know-how yet. And, you know, the days of, you know, because of the oil prices, because of the deficit, you know, the day of, you know, don't worry, we're going to take care of you from A to Z. That's gone. So they need to rely more on the private sector to help them to move forward with patients.
Thank you, Badr. And I guess the new trend of sovereign funds, specifically by long-term investors, has been after the financial crisis, subsequently moving from infrastructure to real estate to use the private sector to gain those understanding of sectors that, of course, they not necessarily know in depth, and also to transfer the know-how domestically. I guess Mubadala in Abu Dhabi is one of the examples, PIF for Saudi. They need to have a return of investment that overcome the financial return, but to have domestically available.
Sorry, just to add one thing, you're mentioning Mubadala and BIF. I mean, today we're working with them on a couple of deals, and we see that they don't want to take the lead anymore. They're happy with 30%. You take the lead, you do whatever you do, and we're happy with the outcomes.
So I think this is a perfect example of how fund owned by the government is using the private sector representative to increase their effectiveness in not only choosing the investment, running the investment, and eventually having domestically. And I guess that's very important because for me, whenever they said, oh, the best specialist for this specific disease is in a country where I don't necessarily feel comfortable, I'm very happy to stay home or where I call home.
So I think on the public-private partnership part in healthcare is really something that all the governments in the GCC are looking forward to, especially from the Saudi experience. Saudi announced that they will be going, the healthcare will be open to the private sector during the past few years. But it was delayed due to the COVID and a few processes and all. But during COVID, we saw that, many of the ICUs, say during the peak of COVID, one of the cities that used to have the maximum number of cases were, Riyadh and Makkah. So in Makkah, around 3 hospitals, ICUs were managed by private companies. There were hospitals that are, 2 of the hospitals that only opened during the Hajj season. These were open and given to the private companies to operate it. So this way, the governments are also opening up for the private to take up the assets and manage it so that the government doesn't have to bear the cost of that. And especially in the past few years, we have seen many of the government hospitals, the university hospitals, the specialist hospitals, have started a private wing. So you don't have to wait for the government to give you the appointment of that. You can pay and you can get the same services. So that is the funding for the hospital. At the same time, you get the care from the same kind of doctors. So I think all countries in the region are slowly moving towards that, where the government doesn't want to take any control. They want to provide the care, but we don't want to be in the front seat. So I think that change will be more evident in the coming months, if not years.
Absolutely, and maybe that will support also a more efficient model, a little bit as both Dr. Ahmed and Dr. Musa said, looking also at when the cure is effective and not only provided. Unfortunately, I saw a sign saying that we are running out of time, but I could not stop unless to ask you a final thought from all the panelists that personally I thank before leaving the floor for questions so much for such an interesting and educative panel. Maybe your final thought, which is your wish, your hope, or your view for the sectors in this future, and I guess the challenging time we are, I would say, still living might be the moment for some hope or wishes for the industry.
No, definitely there's hope, and I think investors have to focus on sustainability. I think there's no way around this, right? Sustainability largely in the region, right, in those fragile states that we live in, largely depends on maintaining a healthy and productive population, right? So I think we now need to look at the SDGs, which are now the global standard for sustainability. We know that across all SDGs, there's $2.5 trillion in gap per year to address them, and yet there's $200 trillion of private wealth in the world. There's a lot of investments that can go into health and with good returns. We're not talking about charity here. We're talking about solid returns for a market that is exploding across the region. But I think my wish is that investors pay more attention on actually what works and what needs to happen in terms of addressing population health outcomes, people's satisfaction of their health system, and of course their ability to afford, right? I mean, the financial losses to healthcare is a big issue across the globe, and we're now playing with health financing in the region, and we need to set up the right systems to protect all and to give access to the majority.
Thank you.
If you allow me, I'd like to paint a final picture, obviously with my words. I'm a terrible artist, but I want to imagine a day where I wake up and the artificial intelligence that is on my watch or maybe on the wall or something has picked up some big data analytics about me or about the society I live in, has accessed my healthcare record that I own on the cloud, has already communicated with my family doctor, and they had a digital conversation together on the blockchain, obviously. And then through this artificial intelligence, it prescribes me a drug which is either 3D printed in my room, so I don't have to go to the pharmacy, or digitally uploaded into my body, which is somehow already connected to the internet. Now, all these technologies in some shape or form exist today. It's not the future, but nobody has kind of brought all of this together under one platform. So this is the future that we will experience, and I hope very, very soon.
Thank you. Very fascinating.
Yeah, I think, investing in healthcare, it's not due to COVID and the circumstances we're living here. And, because of the healthcare market is hot, and that will be a short term, or I wish it could be a long term sustainable. I think it's a great industry. There's a lot of opportunity if you look at it from a financial perspective, let alone from the health perspective. And I think that should be continued. And I hope to see that, a bigger role into robotics, into healthcare. And I think that will help a lot the medical side and going forward.
Thank you.
So I hope to see more investments coming towards healthcare technology that is sustainable, reliable, cost effective, and quality centric. So this way we can have, the primary care in a more efficient way. And I guess this discussion will go on until, Calico or Google comes up with a substantial study wherein they say primary healthcare, it's okay. Now you can avoid it. We are talking about longevity. So, thank you.
Thank you very much. I don't know if I'm most scared of knowing that artificial intelligence knows what I hate yesterday and I shouldn't, and the lack of sport I did, but okay. So I'm so grateful to our panelists for such an engaging conversation, and now I think is the time for the floor to ask some questions. Maybe if you want to introduce yourself before asking the question. I think Michael.
Thank you very much. Appreciate the distinguished panels addressing these very interesting issues and how they affect us all. One thing I'd like to ask you about that you didn't address. In the United States, where I previously lived, I am now happily living in Dubai, we have community outpatient medical clinics, which have now started to replace these cathedrals of care where you're not getting good service, but you're getting outpriced service. These community outpatient clinics basically provide a primary physician. They provide some specialists. You can walk in, it's clean, it's neat, it's efficient, and within 15 to 30 minutes you can walk out. And it's all community related. It is normally sponsored by regional hospitals, and I find them to be exceedingly productive, responsive, efficient, and as you commented on the panel, 90% of your medical care can be taken care of by a primary physician. So I find, at least in the world that I came from, that's an evolving process that seems to be working, where if you go into a cathedral care, a large hospital, obviously it can take hours in an emergency room. You don't necessarily getting the proper care that you need, and it can be costing you thousands and thousands of dollars, where in the outpatient clinic, basically your insurance covers it and you walk out at no charge. Could you comment and see if that's applicable to the region here where I've just moved? And if it is, it could be applicable to what you're discussing on the panel today.
I'll take a shot at this. Yeah, absolutely. I mean, I spent 15 years in the US, and those are models that we're seeing evolving across the globe, right? The hub and spoke, where the hub is shrinking, right? The hospital shrinks, and now you're doing much more in the outpatient space and directly at the community level. This is clearly a model that's possible here. I mean, again, the structures are fairly similar. I think that it's a big paradigm shift because, like I said, I think most patients and Musa asked the right question. Do you have a primary care doctor? 100% will say no here. 100%. I guarantee you this. We do consultations every single day on our platform. Not one single patient out of thousands and thousands have a primary care doctor. So that shift will be difficult, right? Because you're telling people to, instead of going to these hospitals or going to these specialists for their, going to the neurologist for a migraine, they have to go to their primary care doctor. So how do we change that behavior? Well, it takes policies, it takes, government intervention, of course, but the model is definitely desirable. You need to get closer to the community, and you need to keep people out of hospitals. So a lot more of remote patient monitoring, home care, et cetera, et cetera.
If I may add to it, I think that culture used to be here, and then it was changed with the advent of a lot of specialists in the region. So now if you have a headache, you don't think of even going to a primary physician. You directly go to a neurologist. The patient demands that I want to see a neurologist because I have a headache. It could be anything. So I think it has to be a cultural shift that will take time. So with the advent of specialists in every category, the patients demand that, and the providers, just to keep the patients happy, they approve it. So I think it's a cultural shift that takes time.
I think also something unique to this culture, and I see this in Saudi Arabia with some of the large pharmacy chains, is the pharmacist has replaced the family doctor, which is an issue, but I believe in a team approach to healthcare, but the pharmacists have not had the proper training in diagnosing diseases, but they are essentially operating as a family physician, and they provide this community-based care to a certain extent. I would say that in terms of private investment in community-based care, or let's call it retail medicine, which is the term I like to use for the US, where you have the ability to walk in and essentially pay out of pocket or some insurance coverage. That I don't think has really caught on in the region. There have been some attempts by large, mostly real estate development companies to set up these clinics in malls. We don't have this, CVS, Walgreens, Walmart culture, where you go to a big box retailer. Here you go to more of a community-based supermarket, if you would. And then the community-based role is, I think, at least in my country, Kuwait, in certain areas, not all areas, is very well covered. We have 126 primary care centers owned by the government, and they have a pretty robust health IT system set up in the 90s. For what it is, it's very good. But you can see a doctor within 5 minutes, completely for free. Now, it's not very cost-effective going forward, but it leaves little room for the private sector to be involved. So I would say those are kind of the two models that are pretty unique to the industry.
Thank you.
Good morning, and thank you to the esteemed panelists for your insights today. You've talked about some amazing technologies, AI, digitalization. How much or how readily are doctors embracing this as they are a key stakeholder in this process?
I would say very badly. Because the doctors, I would say the new generation, yes, they are, they are very much in touch with it. But the older generation of, your specialist or consultant, they are not ready for it. They don't want it. So it's a difficult approach. But over the time, yes, it will catch up.
And I think to add to that, I think personal experience. I ran a ER in Kuwait before this job, and they had implemented Cerner about 2 years before I took that job, and 2 years into it, the database was a mess. Doctors didn't know how to write a discharge, form, fill out the different sections. So adaptability is important. I think localization is important, right? We can't. I keep saying that we can't just transplant something from the U.S., which has been built for a specific purpose, right? Mostly administrative, legal, etc. Coding, where into this developing culture society with again this heterogeneity of providers, right? So we have to be cognizant of that fact of being able to adapt and not just copy and paste from other places. It doesn't work very well.
Oh, that was weird.
Ahmed Anani, I'm the Managing Director of Sancta Capital. Appreciate everyone's time here. I guess, just brief background. Sancta Capital, we're an alternative investment manager. We focus on providing, equity-like, non-dilutive funding to companies in the region. Healthcare is not naturally something or a sector that lends itself naturally to us, but what we found, particularly in the last 5 years, a lot of healthcare providers, some suppliers to the healthcare sector, seeking out these funding solutions from us. And the root cause of it has always been master payers, effectively the government, slow in settling receivables, causing a lot of working capital issues and backlogs for operators in the sector. To what extent, in the panel's view, do you think this is stifling innovation, capital investment, value creation in healthcare?
To be honest, yeah, I think it's something gonna keep going on. Growing into the near future. Some of the investors usually they don't tap into the healthcare investment just for the reason they don't understand it or how the dynamics works, and it seems like it's a universe that they don't understand it, they can't tap into it, and they tend to shy away from. Now they're feeling more comfortable to use it, to actually invest into it. You see more technology coming up, and they are feeling more comfortable. Let alone, if you talk to, for example, if you talk to my dad or my uncles about VC, they think it's better to do gambling than investing with a fund of VC, But when you talk to the new generation now, all they talk about is VC, angel investing, the private equity, and still private equity, VC still very, very. They are very early in this stage in the region. You don't see a real players that they focused on healthcare, focused on, whether in terms of private equity or VC. And I think this thing will continue growing, especially, seeing now, international players are entering the market. CVC is entering the market as a private equity. You see more funds are focusing on investing in new ventures in the region. I hope I answered the question. No? Okay.
إذا تسمح لي بدر.
Please go. But just to add, I mean, so, for example, what for us as an investment company, we shy away from investment that heavily linked to government because of that reason, the payment. Okay, and especially now in the healthcare, and I'll let Saad to elaborate more on it. But you know, investing in you know linked to the healthcare and related to the government, you know, you will be heavily exposed to the government interaction. So, for example, we have one of our companies that exposed around 70% of its revenue to the government, and we're struggling to have the payment being done. It's a nightmare. So we try to avoid and shy away a lot from government-related, you know, the payers is like the government. We tend to move toward retail, I mean, patients, whether it's insurance or, you know, cash. But we're not looking at investing with more heavily onto. Also, it depends from country to country. You know, that's our experience in Kuwait. I don't know about Saudi and UAE. But tense in UAE is much better, to be honest, especially in Abu Dhabi. But again, you will enter Abu Dhabi, Dubai, Sharjah laws, you know.
And just to add, I mean, at the end of the day, our governments are still triple or at the very least AA rated. So you will get paid, but obviously the cost of capital and, you know, to improve the IRR calculations, you need to get paid sooner than later. Now, I would say that yes, in general, the government is a slower payer than even insurance companies, but that needs to be factored into the project's IRR and the capital and how you allocate capital into that project. I've also seen governments in the region, and the Saudi Ministry of Health is famous for doing this. They will offer a new project, probably at a better margin, to kind of offset that cost of capital. But again, you're not in healthcare because you're here to flip an asset and to make a quick buck in 1 or 2 years. It is literally one of the longest term investments and industries which has a long-term investment horizon. And so you really have to have that mindset going into this industry. It's stable, but it will take a long time. So that's kind of how you have to look at it from your portfolio's perspective.
And I think the payment delay perspective was more, you know, towards the secondary and tertiary care of setup. In primary care, you have a very limited, you know, interaction with the government for collections or any business relation in that case. So, you know, like, say in Saudi perspective, your difficulty more than the government is your insurance companies. Yes. So there, you know, you have a regulatory body, the CCHI. CCHI is coming up, you know, CCHI is always in the middle, trying to help you, trying to bridge the gap, you know, bringing both parties closer. But still, always there is that delay. But governments, you know, as the pros, I would say, you know, the Saudi government has become better. So I think things are changing. But yes, the delay is definitely affecting healthcare on a large scale.
Assalamu alaikum. Abdulrazak Alwafi, Saudi. I really appreciate the panel, the wealth of information that was thrown in. For me, as maybe an ignorant in the medical field, but I was very much enlightened, so thank you very much for that. I have many questions, but I'm not going to take a lot of the time in here, but I do second the issue of you know, the problem of payment or cost of capital, if you want to say, into the health sector. Maybe, Dr. Ahmed, you haven't seen this much from the government side because most of the businesses now has been, you know, medical services along with the insurance companies. But with the current movement of the privatization of the healthcare in Saudi Arabia, I think that would be, you know, an issue. So shying away from investment in that perspective is a major hurdle that I think that has to be addressed. Otherwise, will only be, you know, deep pockets investors that can tap into these opportunities in there. So that's an important issue. And I appreciate the diverse background you gentlemen have. So I would love if you could help us, for example, where would one put his money, especially in our part of the region here? If each one of you from his own background give us a hint, that would be very much appreciated. Thank you very much.
For me, it's a trade secret, so I don't know how to spell it out. No, I think, VC probably, well-established VC fund. If you want to have exposure on IT, in technology in the healthcare sector, and there is more, we see more funds that carry healthcare initiatives. Private equity, there isn't, unless it's international player, or you have to find a specific one who focus on healthcare, but depends on, there's a different strategies to private equity, so depends how you look at it. There's a roll-up strategy, there is LBOs, so depends, there's a focus on primary care, there's focus on dental space, so depends how you're comfortable with the risk that you're willing to take. Trying to be.
This is not investment advice obviously but لا بس شوف سبحان الله يعني لو تشوف السوق السعودي الآن يعني سبيماكو شركة الحبيب ما شاء الله from the time they went IPO until now they're all trading record highs. Last time I looked at Spemaco and I'm on a company that owns a significant stake, I'm on the board. The PE multiple is like 40 times, 40x. يعني السهم كان 15 20 ريال وصل ل 60 الحين 45 وشيء. You can have exposure to these large companies because they are also buying into innovation. I would maybe look at the inverse, what not to do. What I see a lot of family offices doing, again, as an observer of international healthcare, is many families will set up a hospital, right? A traditional healthcare infrastructure, and they'll own the land itself. Now that I don't think is an efficient use of the assets because the land itself is not treating the patients. So what's very common in the US is you have healthcare REITs, real estate investment trusts, which own the physical land or even the building, and then they lease it back to the operating company. So you have an OpCo-PropCo split. And that's something that I feel we need to do more of in the region. Now, the family can still own the land. They can have it as part of their land bank, but don't give the management of the hospital that added comfort that they have that huge asset on their balance sheet. Keep it as a nimble organization that can, and to shore up more capital to focus on the operations so they can give you that 30-40% return, which is, by the way, the private hospitals in the region are much more efficient than the HCAs and the tenant healthcares and the community healthcare systems in the US that are barely squeezing out 4 or 5% EBITDA, right? So to me, again, if I would say where to allocate, I personally like the 70-30%. 70% is in stable, well-known companies, and if we apply it to the region, these are companies listed on the major stock exchanges, and there are some great champions. And then 30% is your risk allocation for growth, where you're looking for that 30% IRR per year, and you hopefully will invest in a company that will become the next champion. So that to me, I think, is a good kind of average to follow.
And I think in the private healthcare, especially now, I'd like to second the opinion of Dr. Masad. Because now the family hospitals or family-owned business are slowly, bringing in operators. You have many operators entering the region, like you have now Mediclinic entering Saudi. So there are more of operators coming in. So the family, the second or the third generation want to, get their hands off the business and give it to more experienced operators who would run the business based on KPIs. And from my personal experience, I would say I'm not a finance guy, but geographically speaking, I would recommend for healthcare, Saudi, number one, and second would be Oman. Oman has a need for healthcare.
Perfect. And with this question, I think we can close this fantastic panel. My sincere shukran jazilan to all the panelists. It's been an amazing discussion and conversation with some secret and less secret insight on where to invest. So thank you very much.
Thank you very much, Dr. Celeste. Thank you very much, Dr. Ahmed, Mr. Vedder, Dr. Musaad, and Dr. Nadeem. Thank you very much. Let's give it up for them one more time. That was such a good panel, ladies and gentlemen.